आज हम शुरू करते हैं क्वेश्चन नंबर 181। द एडल्ट क्लाइंट रिसेंटली हैज़ बीन डायग्नोज्ड विद एस्थमा, विच मेडिकेशन इज रिकमेंडेड टू ट्रीट दिस प्रॉब्लम। एडल्ट क्लाइंट रिसेंटली हैज़ बीन डायग्नोज्ड हुआ है वो एस्थमा में, और उसकी मेडिकेशन रिकमेंड हम कौन सी करेंगे इस प्रॉब्लम के लिए, एस्थमा के लिए? ओमिप्राजोल डेली, और एमोक्सिसिलिन ट्विस डेली, लॉराटिडीन डेली, और प्रिडनिसोलोन डेली। अच्छा, इसके लिए हम ओके, ओमिप्राजोल। ओमिप्राजोल हम इसकी स्टेटमेंट पढ़ लेते हैं। ओमिप्राजोल इज अ पीपीआई यानी प्रोटीन पम्प इनिबिटर। अप टू 19% ऑफ एडल्ट ऑनसेट एस्थमा इज द रिजल्ट ऑफ गर्भ। ठीक है, ट्रीटिंग द गैस्ट्रिक रिफ्लक्स विल ट्रीट द एस्थमा। और सेकेंड ऑप्शन में ये है कि एमोक्सिसिलिन इज अ पेनिसिलिन डिराइव एंटीबायोटिक। द क्लाइंट इज डायग्नोज्ड विद एस्थमा नॉट एन इन्फेक्शन होता है तो एमोक्सिसिलिन देते। देयर इज नो रीजन टू एडमिनिस्टर एन एंटीबायोटिक। अब थर्ड वाला देख लेते हैं, लॉराटिडीन डेली। Loratadine is an antihistamine. ये एक एंटीहिस्टामिन है। एंटीहिस्टामिन such as claritin are used to treat allergic reactions to pollens, dust or other irritating substances. They are not effective against asthma. हम फोर्थ वन देख लेते हैं, prednisone is a glucocorticoids. So ये glucocorticoids is prescribed daily for clients with chronic lung diseases such as emphysema or chronic bronchitis. A client with asthma would not be prescribed a daily steroids. अच्छा, अब 182 देख लेते हैं क्वेश्चन 182। द पोटेंसी ऑफ द इनहेल्ड एनेस्थेटिक इज डिफाइंड एज द मिनिमम एल्वुलर कंसंट्रेशन। जो पोटेंसी है इनहेल्ड एनेस्थेटिक की वो डिफाइन की जाती है मिनिमम एल्वुलर कंसंट्रेशन पे। ठीक है, 5 एनेस्थेटिक गैसेज आर इन्फ्यूज्ड इन 2 kg रेट्स डिनोटेड एज गैस दो gas E with the max noted. Which of the following gases would likely be nitrous oxide? Number 1, gas A max 0.75%. Number 2, gas B max 1.2%. gas C, number C, gas 3C max 2%. और number D, gas E max 105%. अच्छा, अब इसकी स्टेटमेंट पढ़ लेते हैं। करेक्ट आंसर इज डी। वाई? द पोटेंसी ऑफ द इनहेल एनेस्थेटिक इज डिफाइंड एज क्वांटिटेटिवली एज द मिनिमम एल्वुलर कंसंट्रेशन। ठीक है, मिनिमम एल्वुलर कंसंट्रेशन मैक का ये मतलब होता है दिस इज द एंड टाइडल कंसंट्रेशन ऑफ एनेस्थेटिक गैस नीडेड टू एलिमिनेट मूवमेंट अमंग 50% ऑफ patients challenged by a standardized skin incision. Or minimum alveolar concentration is the medium effective dose of the anesthetic. MAG is usually expressed as the percentage of gas in a mixture required to achieve the effect. Number 183, tranexamic acid is a specific antidote of. अच्छा, जो ट्रानिज़ैमिक एसिड है वो क्या है? ट्रानिज़ैमिक एसिड इज अ मेडिकेशन यूज्ड टू ट्रीट और प्रिवेंट, ठीक है, एक्सेसिव ब्लड लॉस फ्रॉम मेजर ट्रॉमा, पोस्टमार्टम ब्लीडिंग और सर्जरी, टूथ रिमूवल और नोज ब्लीड्स एंड हैवी मेंस्ट्रुएशन। इट इज़ ऑल्सो यूज्ड फॉर हेरिडिटरी, ठीक है, एंजियोएडिमा। ये है। अब इसमें है कि फर्स्ट इसका जो एंटीडोट है वो क्या है? फिब्रिनोलाइटिक ड्रग्स है, ऑर्गेनोफॉस्फेट्स है, बारबिटूरेट्स है और हेपरिन है। ठीक है, इसमें से कौन सा है कि हम देख लेते हैं। नंबर 1, फिब्रिनोलाइटिक ड्रग्स। ट्रानिज़ैमिक एसिड इज अ स्पेसिफिक एंटीडोट ऑफ, किसका एंटीडोट है? फिब्रिनोलाइटिक ड्रग का। ठीक है, अब 184 देख लेते हैं। 184, a 49-year-old man with advanced squamous cells carcinoma. Squamous cells carcinoma skin of the skin is treated with topical 5-fluorouracil. He presents to his oncologist for follow-up. In addition to monitoring renal and hepatic function for toxicity, one could theoretically measure levels of which of the following excreted products. अच्छा, नंबर 1 ऑप्शन एलानीन, नंबर 2 ऑप्शन क्रेटिनिन, नंबर सी ऑप्शन फ्लोर एलानीन और नंबर डी ऑप्शन ग्लूकोज। ठीक है, अच्छा, करेक्ट आंसर इज सी, फ्लोर एलानीन, बिकॉज ऑफ इट्स सीवियर टॉक्सिसिटी टू द जीआईटी ट्रैक। सही है, जीआई ट्रैक। 5 फ्लोर एलानीन इज गिवन IV और इन द केस ऑफ स्किन कैंसर टॉपिकली, स्किन कैंसर में टॉपिकली दे देते हैं। द drug penetrates well into all tissues including the CNS. 5-FU is rapidly metabolized in the liver, lung and kidney. It is eventually converted to fluoroalanine, which is removed in the urine, and to CO2, ठीक है, which is inhaled. और नंबर A ऑप्शन में एलानीन था। फ्लोरएलानीन कैन बी मेजर्ड बिकॉज इट इज एक्सक्रीटेड इन यूरिन एंड इनटू CO2. और क्रेटिनिन इज अ गुड मार्कर ऑफ रीनल फंक्शन बट इज नॉट अ डायरेक्ट मेजर ऑफ 5-FU एक्सप्रेशन. नंबर D ऑप्शन glucose. Urine glucose levels would be elevated in patients with diabetes mellitus whose serum glucose levels are above 180 mg/dl. Number 185 question is, a 25-year-old woman was found to have mild hyperthyroidism due to grave disease. अच्छा, ग्रेव डिजीज़ क्या होती है? ग्रेव डिजीज़ ये होती है कि ग्रेव डिजीज़ इज एन ऑटो इम्यून डिसऑर्डर्स दैट कैन कॉज हाइपरथायरॉयडिज्म और एक्टिव थायराइड. ठीक है, ग्रेट डिजीज तो ये हो गई. शी appears to be in a good health otherwise, though rare. A serious toxicity associated with the thioamides is which of the following? Agranulocytosis, lupus erythematosus, like syndrome, myopathy, or Tourette D pointes arrhythmia. Correct answer is A. Agranulocytosis. Rarely the thioamides cause severe adverse reactions that include agranulocytosis, vasculitis, or hepatic damage, or thrombonemia. ओके, हाइपोप्रोथ्रोम्बिनीमिया. ठीक है, अब नंबर 186 क्वेश्चन इज 62-year-old woman with a history of mental decline, impaired physical activity, and significant mood impairment is seen by her primary care physician. Treatment with a tricyclic antidepressant has begun. Which of the following statement regarding this therapeutic option is true? Number 1, mental alertness is likely to change. Mood elevation is likely. Number C is morbid preoccupation will likely. Unlikely change. Physical dependence will occur. ठीक है, करेक्ट आंसर इज डी. मूड एलिवेशन इज लाइकली. द TCS elevate mood, improve mental alertness, increase physical activity, and reduce morbid preoccupation in 50% to 70% of the individuals with major depression. The onset of the mood elevation is slow, requiring 2 weeks or longer. These drugs do not commonly produce CNS stimulation or mood elevation in normal individuals. Physical and physiological dependence has been rarely reported. However, this necessitates slow withdrawal to minimize discontinuation syndrome and cholinergic rebound effects. Okay, number 187 question is: a 72-year-old man is going to undergo a left hemicolectomy. The anesthesiologist is preparing to anesthetize him and plans to use an inhalational anesthetic agent. Which of the following factors will make the patient require more anesthetic agent to achieve the desired response? Number A, chronic alcohol abuse. Number B, diet. Number C, immunodeficiency state. Number D, hypothermia. Correct answer is the A. A is the more lipid soluble and anesthetic, the lower the concentration of anesthetic needed to produce anesthesia, and thus the higher the potency of the anesthetic. Factors that can increase minimum alveolar concentration and make the patient less sensitive include hyperthermia greater than 42 degree, drugs that increase CNS, catecholamines, and chronic ethanol abuse. Number B, diet will not be effect of MAC. Immunodeficiency state will not affect MAC. Hyperthermia will increase MAC. Achha, number 188 question is: a 72-year-old man with type 2 diabetes and hypertension presents to the emergency department. After feeling dizzy and falling in the emergency department, he becomes confused and doesn't know where he is. His blood pressure is 134 per 76 mg. Hg, sorry. His blood sugar is 34 mg per dl. He is given dextrose, and as his blood sugar improves, so does his mental status. What medication would most likely cause this patient hypoglycemia? A, carbos, exenatide, glyburide, or metformin. Number C, glyburide. Side effects of glyburide is that it can cause hypoglycemia. Glyburide is a second generation sulfonylurea that increases the release of insulin. The dose has to be closely monitored to ensure that the patient doesn't become hypoglycemic. A, carbos doesn't usually cause hypoglycemia. If hypoglycemia would occur, the patient must ingest monosaccharides because polysaccharides will not be broken down. Exenatide can cause GI upset and pancreatitis, but doesn't usually cause hypoglycemia. Metformin is effective at lower hemoglobin A1C, but doesn't usually cause hypoglycemia. Pioglitazone can cause weight gain and hepatotoxicity, but doesn't usually cause hypoglycemia. साइड इफेक्ट जो है ना ग्लाइब्यूराइड के, वो ये है कि वो हाइपोग्लाइसीमिया करवाता है. ठीक है, और किसी के साइड इफेक्ट ये नहीं है. द क्लाइंट डायग्नोज विद polycythemia vera is being discharged. Which discharge instruction should the nurse teach the client? अच्छा, ये जो है पॉलीसाइथेमिया वेरा, ये क्या होता है कि ये टाइप होती है ब्लड कैंसर की, और ये कॉज करती है बोन मैरो टू मेक टू मैनी रेड ब्लड सेल्स. दीज एक्सेस सेल्स थिकन योर ब्लड, slowing its flow, which can cause serious problems such as blood clots. Polycythemia vera is rare. ठीक है. अच्छा, instruction should the nurse teach the clients? Number A, take the warfarin as ordered. Number B, do not abruptly stop taking prednisone. Number C, rise slowly from a seated position to prevent hypotension. Number D, restrict fluids to 1000 to 1500 ml per day. Correct answer is A, warfarin. Take the warfarin as ordered. Warfarin is anticoagulant. Polycythemia vera is a malignant overproduction of the RBCs. ठीक है. the blood becomes viscous and has a tendency to clot. Anticoagulants are ordered to prevent clot formation. सही है. Number B, prednisone is a glucocorticoid. Steroids are not ordered to polycythemia vera. Or number C, client diagnosed with the polycythemia vera develop hypertension as a result of the increased red blood cells volume. The viscosity of the blood causes increased resistance in the blood vessels. The blood is thick, viscous, two fluids are increased, not limited. Question number 190. Why did the pharmacist contact Dr. Wonders on 1215 regarding the Courage prescription? Courage is an ARB, so yeah, angiotensin receptor blocker, which is currently not indicated in the treatment of heart failure. Courage is a beta adrenergic blocker in the treatment of the heart failure. The dose must be closely titrated up to the optimal dose. Beta adrenergic blockers should not be abruptly discontinued in a cardiac patient. A only, one only, three only, one and two only, and two and three only. Correct answer is D, two and three only. Courage is a beta adrenergic blockers, and beta adrenergic blockers should not be abruptly discontinued in cardiac patients. Carvedilol is a beta adrenergic receptor blockers that is indicated in the treatment of hypertension and heart failure. When used in the treatment of heart failure, as in Mr. Mutric, does must be slowly and closely titrated up to the maximal dosage every 2 weeks as tolerated. The pharmacist was able to identify that there were no prescription on file for Mr. Mutric for Courage, and there were no referrals provided with the initial prescription of Courage. ठीक है. Okay. Next question is 181. Gentamicin, an aminoglycoside antibiotic, is sometimes given an intermittent intravenous bolus doses of 100 mg 3 times a day to achieve target peak plasma concentration of about 5% per liter. Gentamicin clearance normal 5.4 liter per hour, 70 kilogram is almost entirely by glomerular filtration. Your patient, however, is found to have a creatinine clearance 1/3 of the normal. What should your modified dosage regimen for this patient be? Okay. Number A option is 20 mg 3 times a day. Number B option is 33 mg 3 times a day. Number C option is 72 mg 3 times a day. Number D option is 100 mg 2 times a day. Correct answer is B. If the drug is cleared almost entirely by the kidney and creatinine clearance is reduced to 1/3 of normal, the total daily dose should also be reduced to 1/3. Okay. The nurse is preparing a client for in vitro fertilization. Which statement best describes the scientific rationale for administering supplemental progesterone to this client?